This is Physician Spotlight, where we highlight the top physician specialists in the Mid-Michigan area and their technologies. Have you ever gone from doctor to doctor, eye doctor to eye doctor, trying different types of glasses and contacts, and just having no luck really seeing the sharpness that you feel that you should be able to see? Today I have with me Dr. Michael Wallace, and he's going to talk to us about why that is, why sometimes we just can't seem to find that sharp vision that we're looking for.
Thanks for inviting me on to your spotlight.
You're welcome.
You know, I hear that a lot. Many people have astigmatism. We've all heard of an entity called astigmatism. And it's not a disease, but it is what we call a refractive disorder. It's imperfect optical vision. Many people we're finding now have irregular astigmatism.
Okay.
That's where the imperfection of the visual system cannot be fully corrected in standard glasses or standard contact lenses. And so from year to year, they're frustrated not being really able to see the way they used to at one time. There's a lot of causes of that. Sometimes it's just natural to that person. Other times it's from years of wearing contacts, wearing thick contact lenses or old technology contacts. But now we have a new technology that can address that better than anything that's ever been addressed before.
Okay.
And those are what we call aberration-free glasses, or in some cases, aberration-free contact lenses. They remove imperfections in vision that standard glasses that we've been using since the era of Ben Franklin can't correct. There's probably only about 8 locations in Michigan that have this technology now, of which I'm fortunate enough to be one. And we use that technology to both diagnose and to order special lenses that better correct that.
Okay, so when someone comes to your office then, is there special testing that you do? How does that work?
Yeah, there is. That evaluates those imperfections in the vision. It takes a look at the front of the eye called the cornea, which is the main light-bending property of the eye. And if that's imperfectly shaped, kind of like you might imagine a beach ball being slightly underinflated, this instrument measures that amount of imperfection and designs a lens to compensate ever so slightly for those imperfections. Some eye doctors choose to use that technology, some choose to not. We always want to give persons the best possible vision.
Now, would this be for someone who's just nearsighted or farsighted, or anybody that has irregular astigmatism? How does that work?
Yeah, well, astigmatism is an additional description of a imperfect eye. Of course, persons that suffer from being able to see up close, or their arms are too short, called presbyopia, as well. That astigmatism makes that become an issue in their contacts or glasses as well as they try to see up close. And so I have a lot of patients that come to me and say, I've got these new contacts. They do okay for distance. It's not perfect, but it's okay. But now I can't see up close either. Now what do I do? Well, again, we have technology now that can better address that than ever before.
So if I was to make an appointment at your office, what would my eye exam experience be like?
Most of our patients are very excited about the fact that the examination at our office is unique and different than anything they've ever experienced before.
For more information on Dr. Michael Wallace and achieving the best vision possible, see physicianspotlight.com.